Hi, my name is Tamara Majors, and I am a second grade teacher in Grand Prairie, Texas. Today I will be talking to you about response to intervention and how that looks in my classroom, and hopefully you'll be able to take some of what I do and what we do on our campus and see if you can adapt it to meet your needs on your campus for your students. Response to intervention, or RtI for short, is a method for meeting students' needs just academically and behaviorally, and a way to make sure that all kids are successful. I'm sure you may or you may not have been, but I've been in so many in-services and staff meetings where we have discussed response to intervention and how we can best meet the needs of all of our students and kind of fill in those gaps and get them to where they need to be academically. But there's always a lot of debate about how exactly we can do that in terms of the documentation and how to maintain the documentation and monitor progress of students who are receiving intervention. So in this series or group of videos, I'm hoping that you will get some new ideas for how you can make an action plan for RtI for your classroom, and then also a way for you to document what interventions you're providing and monitor student progress so that you can really see if your interventions are working or not. Now we're going to talk about who receives interventions for RtI, and then also who provides those interventions within the RtI framework. All students are considered Tier 1 for RtI, and that's just the general population. All of your students receive Tier 1 instruction. It's just your good teaching that you're doing every day in your classroom. And then after some testing, universal screening, which could be the TPRI in kindergarten through second grade, or DRA or QRI, which are also reading assessments, or whatever assessment your district uses for all of your students. For math, we use STAR Math. After that screening, any students who are at risk for failure or below grade level, those are the students that you would immediately move from Tier 1 to Tier 2. And for Tier 2 intervention, the classroom teacher provides those interventions. And so I'm working with my Tier 2 students twice a week for 30 minutes to just kind of fill in those gaps and get them to where they need to be. Now, we do also have, for students who are not achieving success at Tier 2, then they would, after a meeting with your RtI case manager, is how we handle it on our campus, then they would be moved from Tier 2 to Tier 3, which is just more intensive instruction. The student still receives the Tier 1 general education instruction and the Tier 2 interventions that the classroom teacher is providing. But with Tier 3, it's just really stepping up the duration and intensity of the intervention. On our campus, we have tutors who come and pull small groups for Tier 3 instruction or intervention, and they work with those students who are just needing, even more help than maybe we initially thought.